Hello, thank you for once again joining me online to look at quality, health, and social care sector. Our aim at this time will try to explain the standards that exist in health and social care for measuring quality. And then we'll try after that to try to evaluate the different approaches to implementing quality systems. And lastly, to analyze potential barriers to deliver quality health and social care services. So this talk will center mostly on 2.1, which is trying to look at all the standards that exist in health and social care for measuring quality. Right. Health and social care, unlike the manufacturing or the service sector, is quite distinct. There are standards that have been set that should be able to achieved, and those standards are used in measuring quality. So there are key standards that is set by health and social care sector. Apart from that, there are some code of ethics that are also set as standard to ensure quality. Example is the nurses, midwifery sector. They have their own standard that they use. GMC, the General Medical Council, has also set their own standards. So if practitioners are able to meet such standard, that is the way that we will use to measure quality. So those standards will be measured against the performance of health and social care professionals to see if we are able to meet the standard. So it's not like using some abstract concept in measuring quality in the manufacturing sector. Quality, if you talk about the manufacturing sector, maybe the car manufacturing sector, you're going to look at the innovation, the interior of the car, to see if it meets the quality that service users or users of the vehicles are trying to look at, so that we can easily measure if users of those cars are satisfied. This is quite different from the health and social care sector, where they've got their own standard that needs to be met, so that we can say from that perspective that the services that they are receiving, that service users are receiving, actually meet the standard. So we're going to look at the standard one after the other. After that, we'll look at the code of ethics. So we've got standards of conduct, performance, and ethics. Once we are able to meet those standards, then we can easily measure this standard and say that, well, there is quality in the service that we are providing to service users, if we are able to meet all those standards. So these are standards that are set by health and social care sector. So let's look at the key standards which are set. Number one, promote and protect the interests of service users and carers. Service users are more or less patients. So the first standard is that in health and social care sector, we should be able to promote and protect the interests of service users and carers. So if we are not able to do that, then we can judge ourselves that we are either not able to meet the standard, we are below it, or we are above it. And 1.1 is that we should treat service users and carers with respect. It's a standard in health and social care sector. Of course, if we don't treat them with respect, then we are not providing the best services to them. So we can measure standard by looking at whether we are able to treat service users and their carers with respect. And in that way, you must treat service users and carers as individuals, respecting their privacy and dignity. We must also work in partnership with service users and carers. We don't take decisions in isolation. We need to involve them in decision making. So as to whether we are able to meet standard or not, we can measure it against these standards. Right. You must encourage and help service users, where appropriate, to maintain their own health and well-being and support them so they can make informed decisions. This is another standard. So all these 3 points come under treating services and carers with respect. And then another standard in health and social care is that we have to make sure we have consent. Make sure you have consent. Whatever we do to service users, we have to make sure that we have consent. If we don't consent, then that is not quality. So you must make sure that you have consent from service users or other appropriate authority before you provide care, treatment, and other services. So you could see that such standards are quite different from what pertains in manufacturing. Challenging discrimination is another standard. You must not discriminate against service users, carers, or colleagues by allowing your personal views to affect the professional relationship or the care, treatment, or other services that you provide. You must challenge colleagues if you think that they have discriminated against or are discriminating against service users, carers, or colleagues. These are standards that are set in health and social care that we should be able to meet in the course of discharging our duties as healthcare professionals. If we are not, then we are not providing quality services. These are standard. Maintain appropriate boundaries. You must keep your relationship with service users and carers professional. We can't go beyond that. We can't develop any special relationship with them. All that we do must be a professional relationship. Shouldn't go beyond that. So maintaining appropriate boundaries is one of the standards which is set by health and social care. Communicate appropriately and effectively. This is another golden standard that is set in health and social care. Communicate with service users and carers, work with colleagues, and the social media and networking website. So let's look at the communication with service users and carers. You must be polite and considerate. Of course, this is a standard that needs to be met, even in the service industry and then in the manufacturing industry, wherever you find yourself. This standard must always be met. Must be polite and considerate. You must listen to service users and carers and take account of their needs and wishes. You must give service users and carers the information they want or need in a way they can understand. And then you must make sure, where possible, arrangements are made to meet service users and carers' language and communication needs. These are all standards that needs to be met in the health and social care sector. So if you are a carer, if you are a nurse, if you are a doctor, and you are not able to communicate effectively with service users, then you are providing below average service. And then you can measure and say that this is no quality. So these are standards that we need to be met. Working with colleagues. Health and social care sector is a job we do in partnership. You need support of others. You can perform your role alone. You always. So one of the standards is for people to be able to work with colleagues, sharing skills, knowledge, and experience where appropriate for the benefit of the service users and the carers. We must also share relevant information where appropriate with colleagues involved in the care, treatment, or other service provided to a service user. For instance, if day staff are taking over from night staff in the morning, they have to work together, share information. All that happens at night duties must be shared with the day staff. In that case, we are working together as a team. That is a standard that needs to be met. What about social media networking side? You must use all forms to communicate appropriately and responsibly, including social media and networking website. Work with the limit of your knowledge and skills. It's a standard that needs to be met. Don't do something that you don't know. Work within the limit of your knowledge. Keep within your scope and practice. And that is, you must keep within your scope of practice by only practicing in the areas you have appropriate knowledge and skills and experience for. You must refer service user to another practitioner if the care, treatment, or other services they need are beyond your scope. It's a standard. You can't refer a patient to somebody who is not knowledgeable in the area. So, as a standard, we should make sure that we keep our practice within the scope of what we know. Don't go beyond something which is out of your knowledge area. Maintain and develop knowledge and skills. As a standard, you must keep your knowledge and skills up to date and relevant to your scope of practice through continuing professional development. That is one of the key areas or key standards that need to be met. So if you're a GP or a nurse and you leave practice for a long time, maybe 4 or 5 years, and you come back, you can't just practice. You need to retrain again. See, it's a standard that because you need to maintain and develop your knowledge and skills throughout your career as a professional. You must keep up to date with and follow the law or guidance and other requirements relevant to your practice. You must ask for feedback and use it to improve your practice. It means that we need to, as a standard that we need to meet as health and social care professionals, we need to maintain and develop our knowledge and skills because things keep on changing very, very fast in the health and social care sector. So as a standard, we need to maintain and develop our knowledge and skills. Next slide. We need to delegate appropriately. It's a standard. Delegation, oversight, and support. You must only delegate work to someone who has knowledge and skills and experience needed to carry out safely and effectively. You must continue to provide appropriate supervision and support to those you delegate. So in the health and social care center, as a standard, make sure you delegate to somebody that you think is competent. And even after delegation, supervise them to make sure they are doing the right thing. This is a standard that needs to be met. Respect confidentiality. Number one is using information. You must treat information about service users as confidential. This is a standard that needs to be made. Disclosing information. You must only disclose confidential information if you have permission. The law allows it. It is in the service user's best interest, or it is the public. It is in the public interest, such as if it's necessary to protect publicity or prevent harm to other people. These are standards that need to be met. Manage risk. Identify and minimize risk. It's a standard that needs to be met. We need to be able to manage risk. You must take all reasonable steps to reduce the risk of harm to service users, carers, and colleagues as far as possible. You must not do anything or allow someone else to do anything which could put the health and safety of a service user, carer, or colleague at risk at an unacceptable rate. Unlike manufacturing, where if the risk is taken, it could easily be rectified. In health and social care, the risks you wouldn't be able to rectify because it might result in poor patient outcome or even death. Report concerns about safety is also a standard. Report concern. You must report any concerns about the safety or well-being of service users promptly and appropriately. So there are standards for reporting concerns about safety, which needs to be met. You must support and encourage others to report concerns, not prevent anyone from raising concerns. You must take appropriate action if you have concerns about the safety or well-being of children or vulnerable adults. And lastly, you must make sure that the safety and well-being of service users are always come before any professional or other loyalties. This is a standard that needs to be met in health and social care sector. Follow-up concern. Having raised the concern, having reported it, there is the need to follow up. Next slide, talk. Being open when things go wrong. As a standard, we must be open and honest when something goes wrong with the care, treatment, or other services that we provide. Right. While we need to apologize, we have to apologize. And taking action to put matters right if possible. And making sure that service users or where appropriate, their carers receive a full and prompt explanation of what has happened and any likely effect. This is also a standard that needs to be met. And as part of being open when things go wrong, we have to deal with concerns and complaints. You must support service users and carers who want to raise concerns about the care, treatment, and other services they have received. You must give a helpful and honest response to anyone who complains about the care, treatment, or other services they have received. So we need to be open when things go wrong. This is a standard. We need to be honest and trustworthy. That is, we need to have personal and professional behavior. Thus, we must make sure that our conduct justifies the public trust and confidence imposed in us as professionals. We must be honest about our experience and qualifications. So you can't be a quack doctor without any qualification and assume that you are qualified so that you can work in the health and social care sector. We must be honest and trustworthy. Important information about our conduct and competence. You must tell as soon as possible if you accept a caution from the police, or you have charged with or found guilty of a criminal offense. These are issues that we have to be honest about, not because you are a nurse and something has happened which is criminal that will bar you from practicing, or for fear of being cautioned that you keep it. That is not a good standard. We must make sure any important information about our conduct and competence is shared. Another standard is good record keeping. Good record keeping is a standard because we are dealing with human beings. So we must keep full, clear, and accurate record for everyone we care for or treat or provide other services to. See, patients and services are many, and there's a likelihood that we might make a mistake and give medication to somebody wrong or represent somebody's illness with somebody else. So one of the standards in the healthcare sector that we can measure is the extent to which we keep our accurate records. Apart from keeping accurate records, we need to make sure that the records are secure. We must keep records secure by protecting them from loss, damage, or inappropriate access. These are all standards that are set by the health and social care sector. Our next slide, we should be able to, so if you look at what we had here, keeping records of your work, we should be able to apologize, making it clear that you are very sorry about what has happened. The Health and Care Professional Council does not regard an apology of itself as an admission of liability or wrongdoing. Therefore, we should be able to apologize when things go wrong. This is a standard. Carers. Anyone who looks after or provides support to a family member or partner or friend is deemed as what? A carer. Right. We need to be able to apologize. Care and treatment or other service is a general term. We are trying to just look at some of the key terms. Care, treatment, or other services. A general term to describe the different work that our registrant carry out. A colleague is other health or care professionals. I would say a conduct is a health and care professional's behavior. Consent is permission for a registrant to provide care, treatment, or other services given by service users or someone acting on their behalf. Delegate is to ask someone else to carry out a task on your behalf. When we say disclosure, in this standard, this refers to making a formal decision to share information about a service user with others, such as the police. Right. Part of our standard is to make sure that we don't discriminate. So discrimination is simply to unfairly treat a person or group of people differently from other people or groups of people. This includes treating others differently because of your views about their lifestyle, culture, or their social or economic status, as well as the characteristics protected by law in terms of age, disability, gender, reassignment, race, marriage, civil partnership, pregnancy, maternity, religion or belief, sex or sexual orientation. So as our standard, we don't need to discriminate. Escalate. Then pass on the concern about service user safety or well-being to someone who is better able to act on it. For example, a more senior colleague or a manager or a regulator. So when we are not able to deal with something, we can escalate it by giving it to somebody else higher than us. Ethics are the values that guide a person's behavior or judgment. And the practitioner is a health and care professional who is currently practicing in their profession. Refer to someone else who provide care, treatment, or other services which are beyond your scope or practice. That is when we do referring. Scope of practice. The areas in which a registrant has the knowledge, skills, and experience necessary to practice safely and effectively. So a service user is anyone who uses or is affected by the services of registrant, for example, patient or clients. So when you are doing your assignment, use the right terminology. This is level 5 work. Use the right terminology to explain. Right. And from all those standards that we've said, we also have professional bodies setting their own standard. For instance, Nursing and Midwifery Council, NMC, they have their code. They have their professional standards of practice and behavior for nurses and midwives. Such code is also a standard. All those who pass out are registered as nurses and midwifery with a PIN that allows them to practice. And as a standard that they need to meet, their standard is being guided by the Nursing and Midwifery Council. They have their own code or professional standard of practice and behavior for nurses and midwives, which needs to be adhered to. So we can also measure standard by looking at the code of professional standard or practice for nurses. If you look at the general practitioners or the doctors, they also have the GMC, General Medical Council. They've also got their code of practice. So every general practitioner who is a member of the GMC need to abide by the code by GMC. So the code of GMC is also a professional standard of practice and behavior for all clinicians, all doctors. So that code becomes a measure of quality, the extent to which practitioners who are qualified actually meet the quality standard of practice. So every organization has got their own code of practice, which is used to judge, or which is used as a standard to measure quality in health and social care provision. So even as the doctors and the nurses and midwives have got their own, the Health and Care Practitioners Council has also got their standard, which I've actually explained on top over there for you to understand. And as a standard, we need to prioritize people, practice effectively, preserve safety, and promote professionalism and trust. These are standards that is maintained by the Nurses and Midwifery Council. In fact, I have put the GMC, the Nurses and Midwifery Council, and PCPC for the Health and Care Professional Council, their code of practice, which are all standards set to measure quality in health and social care practice. So those standards that we talk about are not standards set in manufacturing or the hotel industry. These are specific standards that can be used to measure the quality of health care provision. Right, so these are the actual standards. So in 2.1, if you are asked to talk about, to explain the standard that is used to measure quality in healthcare practice is quite different from those standards that are set in the manufacturing sector or in the hotel industry sector. These are specific standards set in the health and care, and I hope it's going to help you to answer assessment criteria 2.21. In our last lecture, we'll try with approaches that is used to implement quality system in health and social care sector, and to be able to analyze the potential barriers to the delivery of quality health and social care sector. So the important thing is for you to understand the standards that exist in the health and social care sector for measuring quality. Having known this, we should be able to evaluate the approaches and analyze any barriers that affect the delivery of quality in healthcare service. A few references you can read, which is at the bottom of the slide. This is that you can look around and then see how best you can get some information. Right, so I'll put this presentation on Moodle. At the same time, I'll put the GMC, the NMC, the PCPC, which is the care, this code of conduct. I'll put them all on Moodle, assess it, and see how best you can start answering criteria 2.1, 2.2, 2.3. Thanks so much. Next week we'll meet again and continue from where we are and look at how we'll be able to look at the barriers to barriers mitigating against quality service delivery in the health and social care sector. I hope I'll be able to bring you the key standards that are used to measure quality in health and social care. Thank you very much for your time. Thank you. Bye for now.